Hello, greetings from Desmond, Nunez.
Hi, it's Brian Westerberg.
I'm Patricia Lee.
Hi, I'm Scott Durham.
Hi, I'm Dr. Fred Kozak, Program Director for the UBC Otolaryngology Head and Neck Surgery Residency Training Program. I am delighted, along with the rest of our Residency Program Committee and faculty, that you as a medical student are interested in applying to our program.
My name's Eitan and I'm the Chief Resident here at the UBC Otolaryngology Head and Neck Surgery Program. Our program is unique and it's a very strong program with a lot of regard. We have laryngology, facial plastics, head and neck surgery, rhinology, otology, and great programs in all of the subspecialties of ENT, which gives us a really well-rounded experience. We have a lot of success stories. A lot of people go on to do competitive fellowships in the US and in Canada and abroad.
I personally think we have one of the best programs in the country when it comes to sinus. There's really a lot of early exposure. Our belief is that we want to make them really competent in sinus surgery. Residents, depending on their interest, can do clinical research or basic science research with any one of us. A lot of us also work with industry. We also work with a lot of startups.
We have a high volume of head and neck reconstruction. We have a thriving transoral robotic surgery program. We do about 30 to 40 robotic surgeries per year. We also have a fair volume of transoral laser and microsurgery cases, and of course endocrine surgery.
I'm a facial plastic surgeon. We get a gamut of reconstructive surgery and a gamut of aesthetic surgery.
I'm Neil Chadha, the division head of BC Children's Hospital here in Vancouver. We include subspecialty procedures from across the full spectrum of pediatric otolaryngology.
At UBC, we also have several other options for getting involved with international health. One is the master's program that's offered through the branch for international surgery. I help run a few of these courses and they are absolutely fantastic. There are many other staff that do international outreach and also more rural or remote outreach that is not necessarily First Nations based.
We're really lucky here to have the hands-on opportunities we do, and I do think that's a strength of this program. As a R1, you generally get at least 2 OR procedure days a week, and the staff here are all great at letting learners do things quite early on in the operating room, and we get to work with staff quite early one-on-one compared to other programs in the country.
Dr. Fred Kozak, who's the program director, tries to make sure that not only the residents meet the requirements for graduation, but their schedules are modified to what their needs are, and he makes sure that if you have an area of interest, you get more rotations in that area of specialties.
The good transition that our group has is that in the first 2 years of residency, you have buddy call. So as a first or second year, you end up seeing a lot of the call, but you always have a senior to review with. As a third year, you're solo, so third year is kind of considered to be one of the harder years. But that does mean as you work into R4 and R5, you have a junior buddy that's doing your call, but that you also get to speak to about consults.
It's really a very beautiful program. The other thing that I love about this program is you get out of it what you put into it.
Resident well-being is very important. Work-life balance is really stressed. And people choose to be in Vancouver for part of that reason. They enjoy nature, they have hobbies, they spend time with their family. That's very important for resident well-being. Diversity is very important. Diversity for gender, ethnicity, religious background, and sexual orientation. I think that's huge in the culture at UBC.
We have nice residents, nice students, nice staff men, nice nurses, and we have a nice program. So if you're nice, we encourage you to apply to UBC.
The majority of our program is from out of province. I definitely felt incredibly well supported when I got here. I've been in love with Vancouver. I mean, how could you not be? There's no outdoor sport or activity that we don't have access to. The atmosphere in the hospital, the mentality of the people that work here reflects how beautiful of a place that we're in. We make a point of doing resident retreats a couple times a year. Our academic half days are a gift that we have protected time to not only to learn from our staff, people in the program, invited speakers, but our summer half days are actually where we teach each other.
There are wonderful programs across the country, and we are one of them. You will graduate with great training. We're here to help you to make your residency the best it can be. I strongly encourage you to look at our program. We have lots to offer.
We are excited to choose you as our incoming medical students. We look forward to your application and I look forward to meeting you all in person.